Hey there, friends, neighbors, and comrades. It's Jason Wyman here. I am house sitting for a dear friend of mine today, and I'm sitting on her porch overlooking the bay, and it's really delightful. Mount Diablo is just right over there. It's so nice. And it's really given me space to think a lot about our politics and what is personal to me, and really how the personal is political in relation to what we're talking about globally, which is the coronavirus or COVID-19. Recently, I had knee surgery. I had a cyst growing in the lining of my popliteal artery behind my right knee. And so I needed arterial bypass surgery, meaning they took a piece of vein from my thigh and then cut that out. And then they used that to create a bypass of my artery behind my knee. And then they removed a segment of my artery that had this ginormous 8-inch cyst growing in it. Yeah, all kinds of disgusting. Well, anyway, I share all of that because I was able to have that surgery on my knee, which really was hugely affecting the quality of my life. I was not able to walk long distances. When they got it out, the best way to describe it is if you have any kind of, if you can imagine like artery cloggage, due to fatty cell developments or whatnot. Like often we think about strokes in relation to like the blood not being able to flow, and that there's normally some sort of fat deposit buildup within our arteries or veins that causes that stroke. Well, for me, it wasn't a fatty cell tissue. It was a cyst that was growing in the lining of the artery. And so when they took it out, they noticed that the cyst had actually entwined itself all the way around my artery and was starting to choke it off. So it's a really good thing that I was able to have this surgery, that we were able to have the time to be able to correctly diagnose what was going on in my leg, and that as things progressed and as they realized the severity of it, everything was taken care of. Now, I share all of this because I am on a public health program. I do not have health insurance. I am on Healthy San Francisco, and Healthy San Francisco is the healthcare coverage for folks in San Francisco that cannot afford health insurance for a variety of different reasons. My particular variety of reasons is, even though I can potentially afford insurance, I cannot afford the deductibles or the copays in the least. Not only can I not, my husband cannot. He has a standing condition and a standing disease, and so it really relies on a lot of blood tests and a variety of other things that are really crucial for us to be able to have a quality of life that allows us to actually be able to live. And luckily, San Francisco has really good healthcare. Like a good case in point is that my husband has had the same doctor, mostly a little bit off and on because we have been on insurance. And so when we went on insurance, he was not able to see his doctor, his normal primary care physician. And so off and on, he's had the same doctor for almost 14 years, minus the times when we've had insurance, and we have had difficulty finding a qualified doctor for him. So just to kind of put that in perspective, when we had insurance, it was very difficult for him to find a qualified doctor and a regular doctor who was accepting new patients. While on public health, he has had the same doctor the entire time that he's been in the public health system. So just to kind of put that in perspective. For me, I have the same health clinic now, which is really lovely, and it's been a very wonderful health clinic, and it's been a health clinic that has helped diagnose something that was very significant and fairly severe going on behind my right knee in my artery. And as a result of Healthy San Francisco, I was able to get it all taken care of, and I was able to afford it. It cost me $200 in order to be able to have the surgery and stay in the hospital for 3 days and have a very high quality of care that was very meaningful to myself. Now, again, how does this all relate to the COVID, the coronavirus or COVID-19? Well, Healthy San Francisco is here in large part because of the HIV and AIDS crisis of the 1980s. So as we might recall, or as we might remember, when HIV and AIDS was first being diagnosed here within the United States, it was affecting a small population that was very vulnerable to the disease. And that population was queer and trans folks, a lot of folks who were folks of color, a lot of folks who were poor, a lot of folks who may or may not have had different immigration experiences here in the United States. So regardless, our federal government under Ronald Reagan didn't pay attention to it. The CDC did not pay attention to it. A lot of people did not on the federal level under a Republican administration, not just a Republican administration, but really a far-right administration. We don't talk about the Reagan administration within those terms because there is a reverence for Ronald Reagan. But the reality is, when it came to the disease of HIV and AIDS, it was a far-right government. It did not care about the disease. It did not care about the people that had the disease, and its response to HIV and AIDS was inadequate for the context of its impact within communities all across the United States and all across the world. And that's the reality of how the federal government responded to HIV and AIDS. And the only reason that the federal government really did start responding to it is because of local activism across all of our communities here. These are not just the big cities. It is also some of the small cities. It's the Midwest. It's the South. It's a variety of different places that started bringing attention and awareness to this particular disease, HIV and AIDS, in the 1980s that demanded that localities actually take care of the health of its citizens. And so here in San Francisco, we did not necessarily have Healthy San Francisco back then, but we did start building a coalition of community members that were concerned about the public health of its residents. And because we were concerned about the public health of our residents, we started building a movement towards being able to have a real system in place that can care for the residents of this city. In the city of namesake of St. Francis. So how do we actually take care of our citizens, of our residents, of the people that live here in a variety and a multitude of ways? And so, due to the federal government's lack of response, there was real grassroots movement here in San Francisco. And that grassroots movement morphed in the 90s into a broad coalition of queer and trans folks, folks who have emigrated here to San Francisco, and others. And that broad coalition of people are the folks that birthed Healthy San Francisco. And Healthy San Francisco was born in the late 90s. And since the late 90s, or since really 2000s, is when I've had Healthy San Francisco. And the policy idea was really founded in the late 90s, and I believe it was passed in early 2000s, if not around like 1999. I need to look at the exact fact, but around the turn of the century is when Healthy San Francisco was born. And I have been on and off Healthy San Francisco for approximately 14 years or so. I know I had been on it for a while before Obamacare came out, and then the change in Obamacare brought with it definitely some insurance options, and so we went down that path, and then the path actually ended up not really being successful for us given the context of what we need. And so I share all of this because it was a group of citizens working together to change the cultural response to a disease that was affecting the most vulnerable folks in our community. And that matters, and that's really, really, really fucking important in the day and age of the coronavirus. And so when we think about what is our response to the coronavirus, there is going to be a lot of inaction from our federal government. There just is. There's going to be a lot of denial. It's not as bad. It's not that big of a deal. We're working on a cure. We know that those things are not necessarily true. It's abundantly clear by the actions, not by the rhetoric, but definitely by the actions, that the federal response to this is going to be inadequate. And so when we think back and when we look back in our history and we take a look at other times that things have happened like this, even recently in my own lifetime that I can remember, and that I have personally benefited from as a result of the hard-fought work of my fellow residents and neighbors here in San Francisco, we can find ways to think differently and be able to listen through the half-truths and the lies of the federal government, as well as some of the inadequacies of local responses as well. So, we're going to hear a lot about being able to have budgetary set-asides for the coronavirus. Those budgetary set-asides are going to be so that we can have free tests, so that we can have free vaccines, so that we can have a pool of money so that those with the coronavirus can take a sick day. Let me say that one more time. We're going to have a conversation about this only in relation to this particular virus. But what's benefited me is a response that took a look at the entire health and well-being of the residents and neighbors of a particular city, San Francisco, and creating an opportunity and a response that more holistically deals with the health and well-being of the people that we live with. So instead of thinking about the response solely as something specific to COVID-19 or to the coronavirus, we need to be thinking about responses that are holistic in nature, that speak to the wellness and well-being of all of our neighbors, and how we as a country, if we can set aside just in the drop of a bucket, $8.3 billion in order to address specifically and only the coronavirus, then we can have the political will to be able to create opportunities for the health and well-being of our communities, of our neighbors, of the various people that we live our lives with to thrive. That's just actually a possibility. We've done that here in San Francisco, and it's possible not just here, it's possible across the entire United States, and it's possible across the world. This isn't just something also specific to the US. This is something that is global. This is a pandemic. It is happening all across the country, just like disease happens all across the country. And we, as stewards of this planet and of our fellow brethren, have an obligation to ensure that there is opportunities for health and wellness, not just opportunities, but that we really do thrive in our own health and wellness, not just of ourselves, but of our planet. It's too crucial of a time to accept anything differently. So as you're listening to the media, as you're listening to politicians, as you're listening to your fellow neighbors talk about what's going on, really challenge them, really help inspire people to really think differently about what our response is and how we can respond to this particular disease, and use it as a way to pivot, to talk more holistically about the health and wellness of our neighbors and planet. Ciao for now.